Public health officials are now warning against taking a cruise for the time being. So that word to anyone planning to take a cruise in the future. And we have an expert who can talk to that exact matter. Dr. Kate Bunyan is a former ship's doctor and medical director with Carnival UK. So currently she's chief medical director for Doctor Care Anywhere. That's a digital healthcare company. Dr. Bunyan is in London and joining us. The coronavirus cases on cruise ships lately certainly have people wondering about how clean these vessels are. I appreciate you joining us to answer some of the questions people have on this. So to start, I want to ask you, with the term we keep hearing, the cruise ships now getting a reputation as floating petri dishes. Is that fair in your opinion?
No, I don't think it is, and thank you so much for having me on today. I think the reality is that cruise ships have always had really stringent public health measures and really stringent protocols for the cleaning of them. But what this situation demonstrates is just how difficult managing a virus like this is for the long term, when you're looking at having lots of people in the same place for prolonged periods of time, and the challenges of quarantining for 14 days in non-specialist centres.
So is there an increased illness at all, then a risk of illness being spread on a cruise ship, in your opinion?
I think there's the same increased risk as you would find in any semi-enclosed environment. So things like schools, in daycare centres, in care homes, hospitals, prisons. These are all environments where we are kept more closely together than we might be if we were just going about our day-to-day business, travelling from our homes to work. So all those environments have a need to pay close attention to how we clean surfaces, how we look after ourselves in those environments. But in and of themselves, they don't necessarily cause the problem. They're just an example of how the problem becomes more noticeable when you have lots of people together.
And is it trickier to control then? I think in the past, it's not just the coronavirus. We've seen the norovirus shut down cruise ships and essentially create another quarantine situation. That kind of thing has happened in recent years.
Yeah, norovirus is another interesting virus that's incredibly difficult to manage in any environment. But what the cruise industry is really good at is monitoring those cases, spotting them, dealing with them and declaring them. So actually we know a lot more about illness prevalence on board cruise ships than we do in almost any other setting. And part of that is what skews that impression that cruise ships have problems with illness. It's actually that they're really good at knowing what's going on and being able to demonstrate that into port health authorities and be clear about what they're doing to stop it.
In your past role as director on cruise ships, can you give us an insight into what must be going on, for example, on the Grand Princess in the last week? How many medical staff would even normally be on a cruise that size?
So a cruise of that size is likely to have 2 doctors who will be well experienced in managing cases of all sorts of conditions. They'll come most likely for an emergency room or critical care background, and then they'll have a team of maybe 4 to 6 nurses or combination of nurses and paramedics that are also there to support looking after all the passengers and crew who are sailing on board the ship.
So given what we have seen happen with the coronavirus and the testing and people quarantined in their rooms, would that be a real scramble for that number of people to serve a ship of more than 3,000?
It's certainly going to be challenging for them, but it's the sort of situation that the teams know is possible and are ready and prepared for. Managing large numbers of relatively well people is something that the team can organise themselves around, and they can use other members of staff from around the ship to help facilitate that, just as we've seen with the footage coming off the cruise ships around how we organise the delivery of meals, for example, and things like that. But we also know that the medical team will find it more difficult to deal with increased numbers of very sick people, and that's where the importance of coming shoreside kicks in.
Do you have concerns for the health and well-being, and I'm thinking not just physically, but even mentally, emotionally, for the medical staff and indeed the crew? We know in this case the crew has to stay on the ship for a while. Having worked in this setting, what can you tell us?
I think you raise a really valuable point, and that the crew will have worked really hard throughout the voyage because that's the work that they do, and then to have this on top of that does put an additional strain on them, and they'll have really been looked after by the cruise line. Will be wanting to work out how they help to give them the mental health support and acknowledge the difficulties that they've been through, think about what they do with them next, about further rotations, about what sort of leave and support these people will need, because it will have been a big pressure on them that is more than just the day-to-day management of the crew.
Final thought then, Dr. Bunyan, what goes through your head when you hear health officials, as they are here in Canada, saying to Canadians, don't take a trip on a cruise ship right now? What goes through your mind?
I think what goes through my mind is that that's a really difficult conversation to balance, because we know that when we look at the statistics, we're talking about people who are more mature, tend to be the ones that are having more problems with severe illness. But even in that group, most of them will have mild symptoms and will recover without any difficulty. But the statistics don't really pay justice to the human story. And we're talking about people who perhaps have saved up for a long time to take a holiday that has a lot of meaning to them. It's a break that they really need to have, and the benefits that go with having a holiday. So it's balancing that need around how do we manage the social needs that people have and the break and the enjoyment that they get from that, with the looking after themselves and reducing the chances of any one particular person becoming the individual who is most significantly affected. And I think that is a really difficult balance for officials and for the industry to balance.
And indeed, without a nationwide recommendation to not take a cruise, you touch on a great point, and that is the psychological part of it. And for a traveler who, as you say, has been counting on a trip for months perhaps, now having that added stress of wondering, will I get sick if I take that trip? We could talk for hours on all of this, but I have to let you go for time. I do appreciate your insights into this. Thank you so much.
Thank you.
Dr. Kate Bunyan joining us from London. She's the former medical director for the cruise line Carnival UK.